Doctors and nurses have predicted what have been your why didn't you come in sooner moments. Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy parts to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care. And was afraid to take the wraps off even after his foot started to stink. By the time I saw him his skin had kinda liquefied. Earlier on in my career I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that and he said about 2 years. Next time I saw him he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you're diabetic and can't feel the bumps and scrapes, please check your feet regularly. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior and now it was really itchy. Old gentleman. Didn't drive. Lived alone. Got to his house. Unwrapped the ungodly swollen leg to find that he'd tried to superglue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. Guy came in with a dead leg. Waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow but it was way late for that. Guy had several clots in his lungs and legs. Undiagnosed atrial fibrillation. He couldn't believe we were going to amputate. Kept asking me what else I could do. Go back in time a week ago and come in. Kinda around when it turned blue. This happens all the time. People have a big stroke at home and can't move an entire side of the body. They wait several days thinking it's a flu or something. Nope. Not the flu. Just a large clot in the brain that could have been reversed if you came in right away. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. He hadn't been in for an exam in almost 2 years. So the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds. The doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. I've seen a few over the years. And they generally fall into the category of sigh if it's not diagnosed then I can't have it. Or a sigh he didn't think it was that bad. As a medical student I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years. But if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category I've seen a few cases of Fernie's gangrene. Pretty much obese. Male diabetics that had a pimple sore that started in the pubic region. By the time they come to the hospital it's a raging infection where the treatment is basically to cut away everything in the pubic groin region down to the muscle layer. That little sore didn't seem like much at first. Not a doctor, hospital staff. But my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain. Could barely move due to the abdominal pain so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge. Like volleyball size huge. And he may have survived if he came in sooner. By the time we got him to the hospital he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. This has happened a few times. Actually. But I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. So basically, we tell ladies to avoid intercourse until a doctor clears you. And well, her spouse kept insisting that Friday night she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all weekend long. Came into our clinic. Blue in the lips and fingers. And her hemoglobin was 4, normal should be 12-15. She didn't wanna be a bother. So she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. But, like I said, this isn't the first time I've seen that. So for the love of God, if homeboy is begging for it after you just had a baby, maybe he needs a lesson in self-control and a bottle of moisturizer. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound. Don't image search that she'd had for 2 years and hadn't gotten medical attention for. A biopsy and a PET scan later she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia, so it wasn't a money issue. I am a doctor and while working in A&E we had an older chap, possibly in his 70s, who several days prior to presentation had a sudden onset severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day he started to lose the use of both legs and by the time he came to hospital had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event. Developed a clot which his heart had pumped out. It went down his body. Broke in half and blocked off the blood supply to both legs. He literally had dead legs. I don't know what ended up happening to him. But there was no way to save the legs and I reckon the outcome was very poor, if not fatal. Edit because there is a lot of USA assumption going on. This isn't the UK where healthcare is free at point of access. So debt is not a contributing concern for our patients. Children's nurse here. My first week in pediatric ED we had a young girl, 6/7, come in with a really swollen jaw face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mum told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. Had a patient brought in by her son who took care of her. When she arrived to our unit I performed a skin assessment. Took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. Doctor here. Might be a bit late and will probably be buried, but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead he died 3 weeks later. Maggots. Whenever it's gotten to the point of maggots, it's like 100 alarm bells that this person's living situation is no bueno. Maggots in the abdominal genital skin folds of a morbidly obese woman who refused to let her daughter take her to the doctor until the smell was so bad the neighbors complained. Saddest, grossest patient issue I ever saw. And she was inpatient for weeks. With Q4 dressing changes that needed at least 4 people to assist. Awful for her. Awful for us. My cousin is a pathologist assistant and was telling me how she had to dissect a testicle that was 11 pounds. Turns out it was testicular cancer. A lot of times young men will come in complaining of a cough that won't resolve. Usually the doc will ask if either testicle is swollen and the guy will say, well, yeah. Now that you mention it. They won't come in for a swollen testicle, but they will come in for the cough. Unfortunately by that time, the cancer has already metastasized to their lungs. Edit. Okay guys. Please touch your balls on the regular. Especially if you're a young guy. Don't be shy and speak to your doctor if something feels amiss. Hold your penis out of the way and examine each testicle separately. Hold your testicle between your thumbs and fingers with both hands and roll it gently between your fingers. Look and feel for any hard lumps or nodules, smooth rounded masses, or any change in the size, shape, or consistency of your testicles. I work in orthopedics. A very common occurrence is a patient is told to follow up within the week. We like to see fractures between 5 and 7 days, and the patient will call on the 6th day and say I broke something and need to be seen tomorrow. This is frustrating because we very rarely have the ability to get a patient in next day. And if they had called the day of or the day after, then we definitely could have gotten them seen. But my number one why didn't you come in sooner moment was getting a call from a patient who had broken their forearm 2 months ago and never followed up. I got them scheduled. They no-showed their appointment. Rescheduled. They no-showed. Second reschedule. They arrived with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had just come in, it wouldn't have been an issue at all. Blows my mind that they went almost 3 months without care. Elderly woman fell at home and broke both femurs. Son thought she just needed to rest, so he carried her to her bed. She laid there in her own filth for 3 days before anyone called 911. The son lives with her. And there's family next door as well. How? Why? I was working as a surgical junior when my team was called down to A&E to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened and their intestine was visible to the air. It transpired that this was not something that had happened overnight. It had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings. Edit. Addendum, because this is getting a lot of views. I must stress that this case was exceptionally uncommon. And an example of what happens when someone does not seek medical attention when it is obviously required. In general, hernia operations are very common and very safe. That being said, if you have any surgical procedure and you are not certain the wound is healing properly, you must seek medical attention. A colleague of mine removed a diabetic patient's sock and their toes came off inside it. My girlfriend is a care worker and she recently told me that she slipped off a patient's slippers and remarked, "I didn't know you had lost your toes," to which the patient responded, "Well, I had until you took the slipper off, dear." Sounds like something from a grim sketch show. God bless anyone who can do jobs like that. Story from my sil who is a nurse. Young man was brought into the ER. He had a sinus infection that he had let go to the point that it had eaten through the skull and into his brain. She was told that it had started several months before. He didn't want to go to the doctor for it. All it would have needed was 10 days of antibiotic pills. Instead, he was not brought in until he was unconscious and died within a few hours. A&ED doctor here. A farmer in his 70s reluctantly came in with his wife after falling over outside while wrangling a sheep 1 week earlier. He did not want to be there but had been forced to come by his wife, who was worried about him. On examining, he was pale, short of breath, and clearly in pain all over the right side of his chest but not wanting to show it. X-ray and blood showed he'd broken loads of ribs, punctured his lung and bled profusely into his chest and was now very anemic. I'm a resident doctor working in a heavily agricultural part of my country. I've learned to become extremely concerned whenever I see a farmer, especially during harvest season, since being near death is usually the one thing that will convince them to come in. I had a patient come in saying he couldn't see. How long had it been going on? For 5 days. The man had been blind for 5 days and didn't come in because he thought it might be like a cold or something. During the exam, when I asked him to move his legs, he said, "Oh, I can't do that." Question mark? Comma, I asked how long he'd been unable to move his legs or walk. Wife chimes in about 2 years. Never saw a doctor about it, they just borrowed a friend's wheelchair and kept it rolling. Turned out he'd had multiple strokes with multiple risk factors he never addressed. Given how little insight he appeared to have into the condition, I honestly felt sorry he didn't have insurance, so I'm sure that played a role in him avoiding seeing anyone. Not a doctor. Just a student shadowing. During the pandemic, a guy with a history of heart issues had a heart attack. With classical chest pain. Then he had symptoms of heart failure. Which he recognized. Because it had happened to him before. But he still waited a few days because he was worried about coming to the hospital during the pandemic. Finally it got so bad, he couldn't breathe from the fluid backed up into his lungs, that he came to the ER. When he was obviously hospitalized. My professor also said he recently had a patient with an aortic aneurysm who was misdiagnosed because she only had a telehealth visit, no imaging, due to the pandemic. She ended up with an aortic dissection. Edit. She was first seen at an outside hospital, but went to our institution for a second opinion. She did all the right things. Outside hospital made the error to not do imaging. Close bracket. The COVID-19 pandemic is hurting people who get sick. But also all the people not getting the treatment they need because they are avoiding hospitals. Not a nurse doctor but a lab scientist. Had a guy come in at the end of the day for chest pain that's been bothering him all weekend. The ED doc ordered a troponin blood test which helps rule out heart attacks. If the test runs above 0.03, we consider that a sign for a heart attack and act accordingly. This guy's very first troponin was 21.00. 21. The highest we've ever had up till then was an 8.00. The guy should have been dead ages ago. But he somehow pulled through. Don't ignore chest pains. People. Edit. Just wanna clarify that the hospital I work for is a tiny ass 25 bed. Rural community critical care hospital. Definitely not a place with dedicated cardiologists, cath lab, bedside assays, or even a big test menu. Period. Bare basics. And the guy did, somehow, end up surviving. Oh. So many stories here. We can start with a gentleman in his 70s who was diagnosed with diabetes. His doctor had instructed him that it's important for him to wear socks and supportive shoes throughout the day. So this guy decides that meant wear the same pair of socks for weeks and never take them off. He had showered, slept, and carried on in the same pair of socks for weeks. He came to the ER because there was blood oozing through his sock and there was pain under there. Take the sock off. He's got a diabetic ulcer that had opened and was full of maggots. Not a pretty sight. We clarified those instructions pretty quickly. My dad is the one that wouldn't go in. He got a sore in the crease on the bottom of his second toe, the one next to the big toe. So it would be the piggy that stayed home and just kept ignoring it. He would go with his wife to her nail place and have his toenails trimmed, and I think that's where the infection probably got in when they soaked his feet. He blew it off for a couple of weeks until the wife made him see the doc. It's a good thing she did. The infection had gotten into the bone, so they had to snip his toe off to the first knuckle to catch it before it went any further. The doc said had he waited any longer, he could have lost the entire foot. He's lucky to just have a stubby piggy and not a stubby leg. This little piggy died at home. Nurse here. I work in a very rural hospital. And we have a patient population that seems to avoid the hospital at all costs. I have had so many. Usually related to diabetics with foot sores, almost always resulting in amputation of a toe, or more. However, my favorite was an elderly farmer who came in with chest pain that wouldn't go away. As he put it, when we asked him if he had it before, he had said that he had been having chest pain on and off for years. But it would typically go away after he grabbed his electric fence. Apparently, the first time he had the pain he was standing out near an electric fence on his farm. And he reached out to steady himself and accidentally grabbed the electric fence, which shocked him and made the pain go away. So after that, whenever he would have the pain, he just went and grabbed the fence and it made him feel better. He had literally been cardioverting himself for years. He was fixed up and sent on his way, but we all still chuckle about it now and then because he was so nonchalant about it. ERPA here. The worst I ever saw was a man in his 50s who was an alcoholic and had anxiety problems who was brought in by his neighbors for a facial infection. Turned he had squamous cell skin cancer that made the left side of his face look like the Batman villain Two-Face. The CT of his face and neck revealed that it had spread into his lymph nodes and mandible. The skin on his face was literally sloughing off as I spoke with him and the smell was absolutely horrible, and I smell terrible things all the time. I have never almost vomited in a room except for him just due to the smell. I asked him why he waited and he said he was just terrified of doctors and hospitals, and I believe him. He was extremely anxious the entire time he was in our ED. His neighbors were saints. They said they had been trying to get him to the hospital for months but he wouldn't come in. We transferred him to a tertiary hospital with ENT and cancer specialists. When I checked his chart a few days later, they basically said he was terminal. Nurse here. Had a diabetic who couldn't afford to fill his oil tank during the winter. He was young too. Early 40s. Anywho. Had neuropathy in his feet so couldn't feel that they were becoming frostbitten. He had also been wearing his winter boots 24/7 for warmth. His sister went to check on him one day after she realized his phone was shut off by. She brought him in because she thought he seemed off. The doc asked me to take his boots off. One of his toes came off with the boot, no joke. He ended up having a below the knee amputation to one leg and a transmetatarsal amputation to the other and on IV antibiotics for weeks. Diabetics. This is why us nurses always preach check your feet. Had a guy show up in my clinic one day with a complaint of finger swelling. So as the story went, his finger got swollen and painful about a week prior. Just got worse and worse. And about 3 days prior to coming, a hole opened up in the tip of his finger. This is where I, personally, would have noped right to the office. So come the day of the visit, he says, by the way, I pulled something out of the hole in my finger yesterday with a pair of tweezers. No idea what it is. I asked him if he took a picture or kept it. And he produced a tissue from his shirt pocket. It was his distal phalanx, read. Last bone in the finger. The bone had gotten infected and the body did its thing and basically tried to eject what was now a hot foreign body. The guy pulled his fingertip out of his fingertip. A better magic trick I have not since seen. I'm still just a nursing student. But my professor told us a story of when he was an ER nurse. An elderly 80-something-year-old woman came into the ER. And as he assessed her, he noticed her oral temperature was normal despite her neck being extremely hot to the touch. He decided to take a rectal temperature, which ended up being like 103 or something crazy. While he was down there, he noticed something peeking out of her vagina and proceeded to remove it. It was an old sock. She said her uterus had prolapsed months before and she was using the sock to keep it in. They began treating her for TSS immediately, but sadly she went septic and died later that day. Tongue in cheek. He told us she died of toxic sock syndrome. Not a doctor, but an army medic. Had a dude come into the aid station at like 2 AM with his arm all wrapped up. Took the wraps off. He looked necrotic. I asked him what the FCK was going on. Turns out, the weekend before we went out to the field, this man went and got his whole forearm tattooed. He then spent the next week wading through chest-deep swamps, figuring that if he just kept his arm wrapped, he'd be okay. I was like, brother no. Edit. Oh yeah. There was also that time some female LT came in with vaginal pain. Took a look. Saw one vulva infection. Apparently, she hadn't changed her tampon in nearly a week. We, meaning I, while the DR watched, had to retrieve it. She probably thought she'd taken it out. That's happened to me and a friend. I realized after a couple of days. But my friend thought she was dying and went to the ER. Only for them to realize what it was.